Hi, I'm Dr. Jack West, medical oncologist and thoracic specialist at Swedish Cancer Institute in Seattle, Washington. I'm also the founder and president of GRACE, Global Resource for Advancing Cancer Education. I want to talk about PDL1, which is a marker that predicts for the likelihood of a good response to an immunotherapy agent called an immune checkpoint inhibitor. Drugs like Opdivo, also known as nivolumab, Keytruda, also known as pembrolizumab, or Tecentriq, which is known as atezolizumab, and there's even others beyond that. And this marker, which is a protein sometimes seen on cancer cells, is associated with a greater chance of responding well and for a longer period of time on this class of agents. The studies that have been done have not always looked at this, but it's common to try to associate whether the level of expression of this particular protein on cancer cells is effectively predictive of which patients should get a particular treatment with immunotherapy or chemotherapy. And so one of the questions that comes up is, should we be doing this testing for PDL1 before starting first-line treatment? That is, the first treatment for patients typically with metastatic stage 4 lung cancer. Now, the standard of care really changed to make this test something that we routinely do in patients newly diagnosed with advanced non-small cell lung cancer, whether it is squamous, which is about 20% of patients, or non-squamous, the other 80% in North America and pretty much the rest of the world. And that new standard of care emerged because a trial called KEYNOTE-24 directly compared chemotherapy with a two-drug combination to Keytruda, pembrolizumab, immunotherapy in patients who were specifically selected for this trial because they had high levels of PD-1 expression. About 30% of patients have this high level of about 50% of their cancer cells showing PDL1, or more than that, put you in that camp, and about 70% have lower level or no PDL1 expression. This study showed that the patients with high-level PDL1 expression did significantly better, not only in terms of the time before their cancer progressed and the chance of their tumor shrinking with Keytruda compared to chemotherapy, but they actually lived longer. And because of that, this made a new change in the standard of care, and Keytruda was approved by the FDA as a first-line treatment for patients who had high-level PDL1 expression. And so with that, it became very important to do this testing within the first week or two, as soon as you found out that a patient has metastatic non-small cell lung cancer. Now, there's a bit of a wrinkle very recently. As of the spring of 2017, the FDA made an early approval based on a small study called KEYNOTE-21G that actually gave chemotherapy with pembrolizumab, with Keytruda, or chemotherapy followed by immunotherapy in most patients. There are some potential changes as of the spring of 2017 based on the FDA approval of a concept of giving chemo at the same time as immunotherapy based on a smallish study known as KEYNOTE-21G. And this was in a group of patients who had non-squamous histology, so about 80% of the patients we see with metastatic disease, but it didn't require any level of PDL1 testing or expression, and it randomized patients to get either chemotherapy or chemotherapy in both arms with a carboplatin and Alimta or pemetrexed combination in combination with Keytruda. And the study showed that the patients who got chemo with Keytruda had a significantly better time to progression, a significantly higher chance of their tumor shrinking, and a trend that was not statistically significant toward better overall survival. Many oncologists are ambivalent about whether this is really a best treatment approach for patients, but it is certainly an option for some patients. And the challenge and the wrinkle here is that to give this combination of chemo with immunotherapy, here Keytruda, there is no requirement to do PDL1 testing. Nevertheless, most lung cancer experts favor this testing because if we find that a patient has high-level PDL1 expression, we can potentially give them immunotherapy without giving chemotherapy at all, and they may do very well and not have the side effects or other challenges of chemotherapy as their first treatment, and may do well for years at a time. This is still going to be an evolving field, but as of now, most experts recommend testing for PDL1 expression on the patient's tumor to get a sense of how likely or unlikely it is that the patient will do well with immunotherapy versus prioritizing other options instead.